Hello, I'm Dr. David Richardson. As an eye surgeon, I've performed thousands of cataract surgeries. I recognize that each one of my patients specifically chose me to perform their cataract surgery. Some found me on the internet, others through referrals from friends, and many through the recommendations of their optometrists. If you need eye surgery, choosing your surgeon can be a stressful decision. I hope to relieve some of that stress for you by outlining some of the simple things you can do to choose the best eye surgeon for you. So how do you choose an eye surgeon? Most people consider their eyesight to be their most important sense. Yet each year, millions of people have cataract eye surgery without doing any research on their surgeons. Who performs your cataract surgery is one of the most important decisions you will ever make. Luckily, it doesn't take a lot of time to do the research necessary to find an excellent eye surgeon. I will outline a list of 10 things you must know before choosing your cataract surgeon. With this list, you can find an exceptional eye surgeon in less time than many people devote to choosing their next car. First, use caution when evaluating in-network physicians. Despite what's stated in your health insurance marketing material, don't assume in-network physicians provide better quality care. Currently, there isn't a tried and true scientifically sound method for rating the quality of physicians. Any insurance company that suggests physicians participating in its own network provide better quality care is painting an inaccurate picture. Second, ask those you trust. Good sources of information include your internist, optometrist, and friends who have had cataract surgery. Even better sources are the operating room nurses and staff at your local hospital. They are often in surgery with eye doctors and know who has the best hands. Nurses also are by very nature very helpful people and will often be happy to answer your questions. The challenge will be getting past the hospital's automated telephone menu and gaining access to a live operating room nurse. I would suggest calling the hospital's main number in the morning. Choose the option for a live operator. Once you have a live person, ask to be transferred to the operating room nursing station. A nurse will often pick up the line once it's transferred. Third, research your surgeon's education. Where did your eye surgeon train? It's fairly easy to check the ratings for various training programs. Two objective resources are U.S. News and World Report's annual rating of medical schools and eye hospitals, both of which can be found online. But don't get too hung up on the ranking order. If your surgeon trained at a top 15 institution, he or she received a top-notch education. 4. Research your surgeon's state licensure. Make sure your surgeon is licensed to practice medicine in your state. Go to your state medical board's website and do an online search. In addition to confirming a surgeon's licensure, many state websites will also tell you whether there has been any disciplinary or legal action against your surgeon. 5. Confirm that your surgeon is board certified. When a physician becomes board certified, it guarantees he or she has met minimum competency requirements. In order to become certified, an eye surgeon must successfully pass both a written and oral examination. Additionally, younger surgeons must recertify every 10 years. 6. Visit your surgeon's website. You can also obtain very useful information from your eye surgeon's website. However, keep in mind that the primary goal of most websites is to market the practice. You won't find anything negative about your doctor there, but you can get insight into the surgeon's background and practice philosophy. 7. Find out what others have experienced. Are testimonials from satisfied patients available on your surgeon's website or physician ranking websites? Can you review testimonials in your surgeon's office? Will your surgeon provide the names and phone numbers of patients who have offered to act as references? It shouldn't be too hard for your surgeon to come up with a list of people willing to discuss their cataract surgery experience with you. Keep in mind that federal privacy regulations do limit the amount of information a surgeon may be able to offer regarding other patients who have had surgery. 8. Find out how many cataract surgeries your doctor has performed. There is a reason they call it the practice of medicine. Just like a sports pro, a surgeon's abilities improve with practice and experience. Every surgeon requires a minimum number of cases to become proficient. For cataract surgery, this number is probably around 500. But to be safe, choose a surgeon who has performed at least 1,000 procedures. How do you find out the number of cataract surgeries your surgeon has performed? Just ask. If you are uncomfortable asking this question, then bring to your appointment someone who will ask for you. This is a very important question. These are your eyes. You only have 2. Get over your hesitation. Just ask. 9. Meet your surgeon. One of the most important criteria for choosing your surgeon is your ability to trust him or her. Meet with your surgeon. Make sure you feel comfortable with what your surgeon says and with the level of care. Trust is an important consideration that cannot be sufficiently developed until you talk with your surgeon face to face. Finally, get a second opinion. Most people wouldn't purchase a car without test driving at least one other car. Cataract surgery is a very important decision, and getting a second opinion is a smart idea. Many people are uneasy about getting another opinion, but a second opinion is a common medical practice encouraged by the best surgeons. In fact, one quick test of your surgeon's comfort with his or her own abilities is to let him know that you'll be getting a second opinion. If the surgeon becomes defensive about this, then you'll know a second opinion was a good idea after all. Unless you are completely comfortable with your surgeon, get a second opinion. I would, of course, be pleased if you selected me as your surgeon and would be happy to offer a second opinion even if you don't choose me. I hope this advice will be helpful to you as you make this very important decision.